Dr. Bensianoff, do you see children in your practice?
We sure do.
Tell me, what would you suggest?
Yes, we see a lot of kids.
Lots of kids, huh? Okay.
Yes.
Tell me, Dr. Bensianoff, what would you suggest a mom, what would you tell her? Let's just say a mom is having a baby today, or maybe a little bit old already. What would you suggest her that she should do or not do while the baby is very, very young? And when should she start coming to the dentist with the baby? And you know, what's that whole process? What's some of the most important thing a mom should take care of when it comes to children's teeth?
Well, one of the most important things is there's what's called a baby bottle syndrome, where kids fall asleep with juice or a bottle or milk, and they develop a lot of cavities. So mom needs to watch out for that as far as their diet. Make sure that, you know, when they fall asleep, there's water in the bottle, because it could be very detrimental.
Right, that makes sense, because it's like, on one end we're supposed to brush our teeth, so here not only you're not brushing, but you're soaking them in acid, basically.
that is correct. That is correct.
Yeah. Okay,
and you know, there's a very common opinion between parents is that it's a baby tooth. So what? It's going to come out anyway. What's the point of fixing it? The problem is if the baby teeth come out prematurely, that means earlier than they're supposed to, the permanent teeth will start coming in very crooked, and later on we can have a lot of bite problems as well as aesthetic problems. So keeping baby teeth for as long as possible and keeping them healthy is very important. Also, the infected baby teeth can affect the eruption of the permanent teeth and damage them. So that's another reason why baby teeth need to be kept in check, and we need to make sure that you know they don't get cavities. As far as bringing kids in, we can, you know, when the kid is like 2 or 3 years old, they can definitely see a dentist just for a visual exams. But sometimes taking X-rays could be a little bit complicated, but just visually, you know, it's good to bring your son or daughter in to make sure that there's no cavities developing, and the sooner we can catch this, the sooner we can prevent it.
Okay. So when you know, should children come in even before they have teeth, kind of like, or, you know, right as they get them, even though there's nothing to fix, in order to kind of get them familiar with the dentist and stuff like that?
Yes, that's another issue, is when you let your kids don't go to the dentist for a long time, and then they get scared because they hear all the horrible stories, versus when they come in when they're little and they see there's nothing to be afraid of, then later on it can be also a very positive approach.
Okay.
As far as their hygiene, as well as their oral hygiene, because we always teach them how to brush, how to keep their teeth clean, and we educate the parents as far as diet and, you know, making sure that they don't drink a lot of juices or eat a lot of sweets.
Okay. Well, let me ask you, should parents, as the teeth come, or even before, should they kind of like, you know, brush the children's teeth themselves, so that the child might not be able to do it themselves,
absolutely.
but the parents, so that they get used to it again?
Well, parents need to brush their children's teeth before kids can do it themselves. So once they come into the office, we show them how it's done and how it should be done properly and how often it should be done. So definitely it's very important for the parents to make sure that the oral hygiene is good.
Okay.
For their kids as well as for themselves.
Right. Obviously. Yeah, because, I mean, obviously it's you know, habits. We're creatures of habits. And so, you know, if something becomes normal to us because we made to do it, even with a little force sometimes or whatever, then we'll start realizing that this is what we need to do. Anything else you think parents should know, be aware of or not worried? Let's just say a child getting their first teeth and crying and, anything they can do or should do, or just kind of it will go by, don't worry about it. What's the deal there for the ones who didn't have a child yet?
It's normal for kids to have complaints and to sometimes to even have a fever or to look a little sick when their teeth are coming in. So a lot of times parents get really worried and they start calling the dentist and what can we do, and a lot of times it just goes away by itself. You're more than welcome to bring your kid to the dentist so they can, take a look at it and make sure there's nothing wrong. It's just a regular teething. But, it's not such a big of an issue most of the time.
Okay. Well, all right. Well, wonderful. Basically, get the child used, and I think something important you said, make sure that you don't think that, those first baby teeth, they come out anyway, who cares? Because number one, I guess if it hurts, I have heard that baby teeth even can have root canals. Is that true?
Absolutely. Yes, we call it the baby root canal. We're just trying to preserve this tooth and to keep this tooth for as long as possible to make sure the permanent one comes in the right position. And that's one of the reasons why you need your baby teeth.
Right.
To guide your permanent teeth into the correct position.
And if you don't do that and neglect it too much, then the orthodontic bill is huge and the kid runs around with braces for 5 years, right? Something like that. Is that kind of like the idea of it? I probably exaggerate maybe, but as less...
Yeah, you're absolutely right. Yeah, that could be the case.
Okay. So definitely take care of it. And I have noticed that I don't remember really myself anymore whether I was like... Wayne or whatever, but I did wear a suit and tie from the age of 7, literally. I mean, I'm not kidding. I haven't dressed my hairstyle and my dressing style since about that age, but I'm very sure, and tell me, have you noticed that, young children, 6, 8, 9, whatever, they obviously, they want to look good, just like a 16 and a 60-year-old. I mean, none of us wants to look ugly. And so, number one, if a tooth hurts, doesn't matter, baby tooth or not, hurting is hurting. And I assume at least. And at the same token, if the teeth don't look so good, if one falls out too early, and then, if that girl or boy probably is a little self-conscious, and I think it's just fair to give him that same chance of looking good, just the way we would want to do when we are adults, right?
Absolutely. With all this peer pressure going around, absolutely. Children are a lot more conscious about the way they look versus the adults, and
because they probably get teased more often. If you come around with a crooked teeth, I probably don't tease you. But 9-year-olds, they tease each other, right?
Absolutely, yes. That's how they operate.
Yeah. Well, all right. Thank you very much again. Thank you very, very much, Dr. Bensianoff. Bye-bye.